I'm now with Kevin Chen. Hi, Kevin.
Hi, Vincent.
So very happy to be with you. So please, can you share in this context of recovery, what was, the mission on the organization of Didi Group during the crisis, and how you plan the next step? Thank you very much.
Thank you, Vincent. It's a really a pleasure to be here to share with you some of our experiences during the past several months in, as we title here, how to protect our cities during the COVID-19 pandemic. To begin with, I'd like to do a brief introduction of who we are. So basically, Didi is one of the world's largest transportation platforms with over 500 million registered riders, and we provide about 10 billion trips per year across our 15 products in several continents. And right now we provide about 30 million work opportunities for our driver partners, some full-time and some part-time. So that's what we do. And right now we work across several continents in the world. So basically we operate not only in China, but also in Latin America and Asia Pacific. And so here is an overview of our global footprints. We have operations in Brazil, Mexico, Australia, Japan, Chile, Colombia, Costa Rica, and Panama. So right now we cover about 260 major cities around the world through ride-hailing, taxi-hailing, food, payment, and some newly launched delivery services recently after this COVID-19 outbreak. And through our investment and partnerships, you can see from this chart, we work with our partners, for example, Lyft, Uber, 99 in Latin America, Ola, Careem, Bolt, and Grab. So that's our global footprint. And we have accumulated significant technology over the past 7 years in the field of transportation. And we basically apply our know-how in two focus areas. One is how to provide smart transportation for the cities, how to provide one-stop online management platforms with powerful analytics of traffic patterns and congestion points to help municipal authorities to work out customized solutions. We right now work with about 20 cities globally on our smart transportation projects. And the second one is our safety standards. So in the past, Didi has been through some serious safety incidents, and learning from those painful experiences, we have developed some effective safety measures. As you can see on the right-hand side of this slide, a lot of the protection systems that we do to protect our drivers and riders. Now we have developed vigorous driver and vehicle verification processes, real-time safety monitoring capabilities, and a variety of safety functions, such as itinerary sharing, emergency contacts, facial recognition, SOS buttons, etc. So those are how we apply our technologies for the smarter and safer cities. And now I'd like to move on to the topic today, what happened during the COVID-19 outbreak and our efforts. So at Didi, a special COVID-19 task force was created in early January to coordinate all the defense and relief efforts across our over 1,000 cities in China and outside China, like in Latin America and Asia Pacific. So the task force and all our teams under the task force are in charge of collaboration with WHO and health experts to prepare contingency plans to protect the safety and health of our global communities. And at a later stage, they worked hard in terms of borrowing the China experience to address local needs and priorities globally. And there has been a substantial leverage of digital technologies and our offline driver support networks to combat the virus, which has been proven quite effective in China and are now adapted in other markets. And our actions during the COVID-19 crisis has been driven by three goals mainly. Number one, how to protect the health and safety of employees, drivers, and our riders. Second, how to support the communities we operate in. And the third goal being how to help our driver partners through this very difficult time. So here are some of the examples of the measures that we took in protecting the health and safety with our online technology as well as our offline organization. So during the past several months, we required in China to take protective measures. We, in order to help them, we distributed free protective gears and sanitation supplies to drivers. And we launched some of the Didi disinfection stations in about 200 cities across China. So that's what you can see on the left-hand side of the slide. And one thing that we put a lot of efforts into was a so-called Didi bubble caught by our drivers, which means the plastic protective shields that we installed into our vehicles. So we invested about 100 million RMB in installing those plastic protective shields into our vehicles between the drivers and our passengers to prevent droplet transmission. And later on, that practice has also been adopted by the traditional taxi industry in China, as well as some police patrol cars here. And as you can also see, we have been very focused on digital sanitization and health management. We put a lot of QR code into our vehicles so that our riders can check the vehicle sanitation and disinfection status. Like they can see when and where those sanitation processes have been done. And lastly, we provide a lot of in-app safety instructions and hygiene tips, as well as real-time data on the spread of the virus. So people and our hundreds of millions of riders can be more aware of how to protect themselves. So those are the measures that we undertook. And beyond these measures in our daily business, we took some additional responsibilities. The things we did was Didi dedicated fleet for healthcare workers and communities during the suspension of taxi and public transit in multiple cities here in China. In China, we have over 160,000 drivers who signed up to join the special fleets for our medical workers in 15 cities. And they helped close to 40,000 doctors and nurses. And we also had 1,000 drivers who volunteered to join our community fleet in Wuhan, because back then the entire city's public transit and taxi services have been suspended. And globally, we launched this Didi Hero program, as you can see here, a poster of it. We had close to 50,000 drivers who signed up to offer free or discounted services for communities and health workers across Latin America as well as Australia. And the second thing that we did was that in China and globally, leveraging our sourcing capabilities, we donated medical supplies to local hospitals and communities, even the taxi companies across the domestic and international markets. In some areas in China where there were a shortage of supply, we also donated some family care products to our female medical workers, especially in Wuhan. And here,
当疫情来临时，我就觉得我应该留下来，帮助需要的我帮助的人。衣服穿上。啊？哦，你帮我，你帮。出发。我现在去川口中西结合医院，然后帮人去拿点药，然后给人送过去。现在取得这个药了，就赶紧出去。进来这个感觉，其实真的还是心里有点紧张，不知道为什么，就是一下那种紧张感油然而生。不过没事，年轻人身体好，抵抗力比较强。地震后，我活的每一天，我觉得我都是赚来的。
300米处有视频监控。
你好。哎，你好，你好，来。
谢谢你，谢谢你。
没事。
每次都麻烦你。
没事。因为我怕明天我又没什么时间，因为这2天比较忙。我看今天还早，我就先给你送过来了。
我知道，你们是够忙的了。
哎，好，行，那你先讲哈。
谢谢你啊。
啊，没事没事啊。今天差不多就收拾了，回家去。先去给车子充个电，然后就回家。
Yeah, just to add on that, as you can see, Wang Li is just one of the 160,000 drivers who volunteered, and as she said, that was a very stressful situation that made everyone nervous. Like nobody wants to really go to the hospitals during that kind of time, but we do see a lot of energy and willing to help from our driver partners. So those has been a very tough times. And the COVID-19 pandemic actually has very deep influences over the entire society, not only the direct ones, but also indirect ones. In terms of the entire value chain of transportation, many of our partners have been affected seriously. For example, a very serious problem was that our drivers, many of them got their vehicle through leases from leasing companies or auto OEMs. And due to the lack of demand in the past few months, many of them were unable to pay back the lease. So one of the other things that we did was how to support our partners. In China, we coordinated about 3,000 leasing companies, 40 insurance companies, and more than 20 financial institutions nationwide to promote an extension of the leases and insurance coverage fees for our driver partners, and just to help them keep afloat. And also we tried very hard to diversify income streams for our driver partners. So we launched Didi delivery services in 21 cities in China, leveraging our pool of drivers. And also we launched the Didi food service in Japan in April, just to help our driver partners to get through this very difficult times. And during these processes, our auto OEM partners, including Renault, we work in both China and Mexico in terms of fleet operations, have been part of the efforts. So in addition to that, starting from about late February, and especially after March, one of our key priorities was how to take our learnings and lessons in China global in other markets. And for example, we started distributing protective gears and donating medical supplies to hospitals and communities globally, starting from February and early March, including taxi companies across our international markets. And same as China, we started to provide our in-app information hub to provide COVID-19 related information to our riders and drivers globally. And we installed those motorized sanitation stations in Brazil. As you can see, the picture there with a 99, which is our brand in Brazil. Those are the motorized sanitation stations we put in there. And we also started installing our plastic protective shields in Latin America, starting with 20,000 vehicles in Mexico recently. And we also have set up a relief fund of $10 million dedicated to drivers and couriers who have been impacted by the COVID-19 pandemic. And we launched our on-demand delivery service in Latin America and Australia, and full service in Japan, so that there will be additional income opportunities for the drivers who rely on us. And we, same as China, we provide our free rides and meals for healthcare heroes through the Didi Hero program. Our special service fleets for frontline medical and relief workers, close to 50,000 drivers have signed up to offer rides and meals to communities globally. So that has been our focus in the past 2 months. And going forward, we are preparing for a probably very slow but phased recovery effort. We do see cities recovering a bit and demand coming back in China since late February, beginning with the commuting demand as people, as a flattened curve and the people coming back to work. And later on in March, we do see trips for some outdoor activities coming back strongly. And in major cities, we see a rise of bike and e-bike trips grow very strongly as people perceive those as safer transportation options. And we are continuing to monitor the situation closely and maintain all healthcare precautions and effective protective measures. So how could our cities change? That's also a question that we ask ourselves very often. And we do believe that in the future, the city designs will take health and safety into it with higher priorities. And we do, through this experience, see that stronger public-private partnerships are needed to design integrated solutions and responses to this kind of crisis. And we do see new directions on how to apply our data technology to urban management will be very effective in this kind of crisis response. Of course, at the same time, how to protect our citizen privacy will also be one of the key topics that we need to explore together with the authorities. So that's also an open topic that we are exploring going forward. So those are the topics that I would like to share with you.
Thank you very much, Kevin. It was a very, very interesting, share of insights. It's very interesting to see that with all the countries you manage and the cities that you have to engage with, you succeed to deploy all those, all those actions. So thanks to the community, we have some questions that pop up. So I will ask you some questions from the audience. So the first question will be, when was the darkest moment for you in the fight against COVID-19?
The toughest moment, right?
Yes.
Yeah. So I would think the toughest moment would be around the time of the Chinese New Year. That's in late January. That's when, as you all know, when Wuhan began enforcing the strictest quarantine measures. And back then, I still remember on the Chinese New Year's Eve, which is kind of like the Christmas Eve in Western world, we had kind of like the whole team was on conference call all night through the New Year's Eve, talking about what we could do in Wuhan back then, because back then all the public transit, taxi services, everything was shut down. But at the same time, medical workers need to go to hospitals, and Wuhan was a gigantic city with 9 million people in the city back then. So we were talking about how to set up both our online product as well as our offline fleet operations for those medical workers, and as well as for the communities, because back then there were still people in the communities who are sick and who need to go to hospitals and who need to travel, not necessarily only for the COVID-19, but also for other like diseases that they need to go to hospital. There were essential needs that need to be served. So those were really the toughest time. Like a million things need to be sorted out, especially how to get the essential supplies so that our drivers, as you could see from the video clip, so they at least could have the protective gears and the masks to do their work. And those, I think that kind of hectic period lasts for like 2 to 3 weeks. Like everything was very chaotic, but through all those chaos, we need to manage to focus on our work, get the fleet set up, and really to serve the medical workers and community. So, but I do think through those tough times, it was very worthwhile to act like very strongly and with all the efforts from the very beginning, and the focus of the work in those 2 to 3 weeks really helped the curve to flatten like 1 to 2 months later. So okay. Yeah, that was the toughest time.
I will pick another question. So let's pick this one. As a tech company, how do you see the role of technologies in helping with the COVID-19 situation?
Yeah, so I do think in this COVID-19 response experience, technology platforms have proven that a lot of the data technologies and capabilities were useful in terms of helping the health authorities combating this virus. For example, ride-hailing, which we do itself, is fully traceable for health and epidemic research purposes, and that was proven very effective in keeping people safe. So it's inevitable that during a period of time, there will be people who are positive with the virus out there, and the ability to track was very important in terms of containing the problem. And also technology was essential in terms of we developing flexible ways to organize our essential mobility services. For example, our fleet product for healthcare workers and communities, those were set up online in just a matter of 15 minutes. So the flexible platform can provide a lot of a special period mobility services. And also we opened up our cloud computing and data capabilities to a lot of the health authorities, as well as non-government organizations during this period. And we provide a lot of data for them to generate insights in aggregate, of course, because in this period of time, how to do those effective work. At the same time, also protecting our data privacy and how to abide by our commitments to our customers in terms of privacy would also be a very important topic. So I think, yes, the digital innovations can play a very pivotal role in the response of the COVID-19.
Thank you very much. I will pick the last question for our audience today. How does this pandemic change your business strategy?
Well, in terms of business strategy, I think one thing that we learned over the past few months was that we were widely perceived as a technology company, but this pandemic proved that the importance of offline operations can never be overstated, because there are things that we have to do offline, have to do physically, for example, installing those plastic shields, etc. So we have a team of over 1,500 managers offline to help drivers do that. And those offline operations have been proven very, very important in terms of helping people to improve safety during the pandemic. And the second thing I think that fundamentally changed our view about business is that we need to continue to strengthen our partnerships with the entire ecosystem of transportation, including our auto OEMs, our leasing companies and insurance companies, because the pandemic, it not only affects people's health, but also the entire economy was hit really, really hard. So how to work with our upstream and downstream partners to work together to help the driver partners, not something that the technology platform can do by itself. So strengthen the partnership and working together with all the partners. It's also an important part of the business model that we need to strengthen going forward. And lastly, I think it changed somehow the relationship between us and our cities and communities. Like we need to build a smart transportation network together, hand in hand, and we cannot afford in China, like each person owns their own cars, so that to prevent the virus in that way, we have to do it in a shared way. But that makes us think how that we can better enable our bus networks, subway networks, how to help the municipal governments as well as the communities to do the entire transportation in a safer way. So I think those are the changes that we need to make to our business models.
Thank you, Kevin, for your time on this moment together. And I hope the next weeks for you will be the weeks of recovery in all the countries. And let's stay in touch and hope to see you soon in real life.
Thank you so much, and good luck to everyone. Thank you, Didi.
Thank you, Kevin.
Thank you so much.